دكتور مساك الله بالخير، تشرفنا بلقائك معنا اليوم. في البداية دكتور ممكن تحدثنا عن نفسك ولماذا قمت باختيار تخصص العمود الفقري؟
I'm Dr. Verapan Konsong Tham. Originally, I'm a neurosurgeon, the brain surgeon. And for neurosurgeon, we operate both brain and spine. Okay, that is my basic training. I'm the chief of the SpineInstitute for now.
Yeah.
So over 25 years that after I finished my training as a neurosurgeon, I do both the brain and spine. But in the past 15 years, I have to talk back to 20 years ago. I have the slip disc myself, okay, rupture disc, back pain, leg pain, and I even underwent surgery by my neurosurgeon colleague in the university with the open technique that time. So 15 years ago, I happened to see the new technique from Germany, Professor Sebastian Rutten. And with the 8 millimeters, less than 1 centimeters wound with the endoscope. So I look at it from the patient perspective, not from the doctor perspective. So I know the difference between open surgery and imagine aerobic patient with a lot, and then you have to big cut 5 to 10 centimeters. But with endoscope, it's less than 1 centimeter. That's how I started to focus more and more on the spine surgery, especially the endoscopic one. That's my story.
إن شاء الله. دكتور ما هي أسباب مشاكل العمود الفقري؟
If you talk about a symptom, okay, so our spine is the extension from your head down to the bottom.
Yeah.
Is the neck, cervical, the thoracic, and the lumbar, the lower back spine. If you talk about the symptom, the mobile part is the neck and the lower back. You come with the neck pain, back pain. That's the most common symptom. But that 60% of it is not the spine problem. It's only the muscle problem. Okay. So if you ask me what is the most common symptom, is the back pain, neck pain. But if you ask about the real spine problem, it has to be the nerve pinching symptom, that the neck pain, if it pinch the nerve, it goes down to the arm. If it's the back, it's a pinch the nerve from the lower back run down the leg. So you come with the sciatica and the arm pain or leg pain. So these are the most common symptoms.
اوكي. دكتور ما هي طرق العلاج المتوفرة لديكم في مستشفى بمرغراد أو ما يعرف المستشفى الأمريكي؟ وما الذي يميزه؟
Of course, that's a good question. When you talk about the spine, okay, I have to explain you the basic. Most of the patients that come to the hospital with the back pain, neck pain, 60% can be treated conservatively. Rest, painkiller, physical therapy. Those kind of patients stay in their countries. They are not coming to us. Another 40% that treated already but still pain, still problem, these patients come to us. So we provide here. We have physical therapy as well, okay? But we have two kinds. More than physical therapy is intervention. Intervention is a procedure done under local anesthesia with the needle, like cortisone injection, laser, radio frequency therapy, not the surgery, okay? It's a procedure done under local anesthesia. And the last step is surgery. I'm a surgeon, I'm doing surgery. If you talk about normal spine surgery, we call it open surgery, or even with the microscope. We have been using a microscope for surgery for almost 55 years, at least in Thailand, because my professor is the one who brought back the microscope to Thailand 2 years after I was born. Yeah, so we talk about 54 years ago that we have been using microscope. Common surgery everywhere at Bamrungrad as well. But what makes us different from other hospital or other center is that I explained to you that I started doing endoscopic surgery in 2007 with Professor Sebastian Rutten with one whole surgery. That make us different from the beginning. And then that substitute the open surgery. So more and more big patient, old patient coming to us to avoid open surgery. That make us different. But over the past decades, we have been teaching other hospital, even other medical school in Thailand, how to do this technique. Because Professor Sebastian Rutten from Germany is the one who invented this technique and the instrument, and we are friends. And we teach every year. I have to go to Germany twice a year, help him teaching the European and the American surgeons. And here at Bamrungrad in Thailand, he comes and we both teach the Asian doctors. We have been doing this for the past 13 years. We have been training the spine surgeon to do endoscope technique, over 2,000 spine surgeons all over the world. That make us different from other hospitals. So we are not only expert in endoscopic surgery, but we are master, we teach. And over the past 13 years here, I have been operated over 1,300 cases. That is another thing to show our expertise, number of surgeries, and last but not least, the result of the surgery we publish in the international publication. Yeah, that make us different.
دكتور حدثنا عن جراحة العمود الفقري بالمنظار.
The endoscopic spine surgery is instead of you want to remove some disc on the bone that pinch on the nerve, okay, which is deep in the patient, in the middle of your body. So the bigger the patient, if you do normal technique, the bigger the wound and the bigger the cutting, because you are looking from outside the patient. But with the endoscope, I have a lens with the light and the water irrigation at the tip of the endoscope, and we insert the 7.9 millimeters, smaller than my little finger, down, and we're looking from inside the patient. That's the big difference. That's why it doesn't matter how big the patient is. We make one hole, same. But with open technique or microscope, looking from outside technique, the bigger the patient, the bigger the wound, the more pain, the more bleeding. But we have the same result. You are recover from the pinched nerve, but we have less pain, shorter recovery, and you walk immediately once you wake up from the general anesthesia. Normally we admit patient less than 24 hours, and you walk immediately. That's a difference.
دكتور، ما هي عدد الحالات التي تم علاجها في معهد العمود الفقري في مستشفى بيمرنغراد أو ما يعرف المستشفى الأمريكي؟
So if you talk about the outpatient, I cannot remember exactly the numbers, but if you ask me about the procedures done by us per year, is over 1,000 cases a year. And over the past 10 years that we opened the Bamrungrad Spine Institute, we have the numbers, we collect the numbers. Right now, I think it's something over 12,000 cases done. Half of them are surgeries. Half of them are intervention with the needle. But it's the procedure, we heal the patient. But if you ask about the outpatient, we're talking about 12 to 15,000 a year. The outpatient.
دكتور، ما هي نسبة نجاح جراحات العمود الفقري في مستشفى بيمرنغراد؟
Normally, there are many kinds of spine surgery. Endoscopic is one type. Other type, we have to put the screw for the more severe patient, collapse or loose joint, we have to put the screw. We call fusion surgery. We also do with a minimally invasive technique. So if I talk about the overall success rate for every procedure in our Spine Institute, is over 90 to nearly 95% success rate with the low complication. And we just verify the numbers. When you look at a certain center, you don't look only at the success rate. Okay, more than 90 is good enough. We have nearly 95%. But you also look at the complication rate. The most dangerous one is infection. If you get infection after the surgery, we even benchmark with the certain international university or institute in United States. I don't want to mention the name, but they have 1.6 infection rate, which is considered low already. But for the past 10 years for us, we have 0.33% infection rate. This is most important. What the patient wants the most is good success, low complication, quick recovery, predictable outcome, not only success, so they can plan the stay. Okay, least unexpected event. okay, and we achieved that. And the reason behind, the first thing, the surgeon, we always, I'm the teacher from the university, I teach my medical student or the fellow surgeon. The first thing to achieve is the indication for surgery. If you don't have the right indication for surgery, you cannot have a good result. So here, I'm a chief here, we are very strict about, if you go to the certain doctor and they want to do surgery on you, they give comment, you need surgery. It doesn't finish there. We have the committee, we have the meeting every week, and we know the case going on every day on the daily basis. And if anyone in the members say, I don't agree with that doctor's decision to put patient on the table and do surgery, we stop the surgery. And then we review again other alternative, other choice that we could do with the patient instead of surgery. So we are very strict because the patient come to us asking for whether they want surgery, whether that can be done with the endoscope. So we have to be very straightforward, honest to the patient and keep our integrity. So this is the key of success for us, and very good. We have a very good members. We have up to 10 surgeons full-time and another 20 surgeons part-time from the university, and work like a group practice and a group idea. Okay, so when you come to certain doctor, you don't get only opinion from one doctor. You have the backup group opinion as well. That's a key of success for us.
دكتور، في الختام ما هي رسالتي تود توجيهها لمرضى العمود الفقري حول العالم؟
Better prevent the problem. Okay, prevent and is better than to go for surgery. Okay, prevent mean don't gain weight, don't put the weight on yourself, heavy lifting, backpack, okay, water sport, high impact. Okay, so prevent of the heavy duty or heavy load, and enhance your body by build more muscle around the spine. That is the prevention. And when you have problem, the serious sign and symptom, you have to see the specialist, the spine specialist right away. Don't keep the problem too long. It will be more and more difficult to solve even with surgery. One patient needs surgery. If you delay the surgery for 3 months, 6 months, 1 year, even the same doctor is doing the same surgery, you get different result. Okay, because the nerve damage happen every day. Okay, prevention, and when you have problem, respond. And then after the treatment, you go back, you have to change your lifestyle. If you do the same problem keep happening to you again. Okay, what the doctor do to you, or even the best surgery on earth doesn't prevent the new problem, because we have 33 joints, the spine. The problem can happen the same joint or the different joint. So you have to change your lifestyle once you have the problem.
نعم. كل شكر لك دكتور، تشرف بلقائك معنا.
Thank you.